Hi, in this video we'll be seeing about Treacher Collin syndrome. So this is the third video in developmental disturbance of jaws. In the previous two videos we have discussed about agnathia, micrognathia, macrognathia and peri-Robin syndrome. So seeing about Treacher Collin syndrome, we will be discussing it in various subheadings. Like first the various other names, then introduction, causes, clinical feature, then differential diagnosis, radiographic features, treatment and prognosis. First coming to the other names of the syndrome, the other names are Mandibulofacial Dysostosis, Francis-Shetty-Swallen-Klein syndrome. So first, from the term Mandibulofacial Dysostosis, we can get an overall view of what is the syndrome. That is, mandibulofacial means represents the mandible and the facial region. So the term dysostosis, you can just divide it into two. So this means there is a defect or default. Ostosis is there is bone formation. So dysostosis is there is a defect in bone formation. So overall mandibulofacial dysostosis means there is a defect in bone formation in mandibular and facial region. So coming to the introduction, Treacher Collin syndrome is a genetic disease, and when genetically inherited, it is inherited in an autosomal dominant pattern. So first in the literature, it was given by Berry. Mandibulofacial dysostosis was first described by Berry in 1889. And later it was Treacher Collin who gave a detailed observation about this in the year 19,000. So after that, the syndrome was also named after Treacher Collin. Now what is the gene getting affected? Everything we'll study under the topic cause. So the gene which is getting affected in Treacher Collin is Treacher Collin Francis-Shetty-1 gene, that is TCOF1 gene. And this gene is located in chromosome number 5. In 5th chromosome, it is located in 5q31.3 to 5q33.3. Now a detailed molecular analysis studies was done to know how this gene is getting affected and how the overall things are happening. So in the study it was shown that there is insufficiency of TCOF1 gene. The TCOF gene was insufficient, which caused resulting in reduced number of the most important cells, that is neural crest cells, precursors. So insufficiency of this gene was causing reduced number of neural crest cells, precursors. So the number of neural crest cells which is going into the craniofacial region was getting reduced. So there was less migration. There is reduced number of migration of neural crest cells into craniofacial region, resulting in overall defect. It's not only that Treacher Collin syndrome will always have a family history. Sometimes with no family history also, this syndrome can occur. So these are about the cause. So you just have to know mainly the gene name and also its chromosome number 5, and mainly it is not only due to a family inheritance, it can also occur due to a new gene mutation. Now coming to the clinical features. So we have to know the occurrence. So this syndrome is about 1 in 50,000 births. 1 in 50,000 births we can see the occurrence of Treacher Collin syndrome. Now incidence among gender, male and female, it is equal, 1:1. Both male and females are affected equally. There is no gender prediction. Second, which arches are affected during development is first and second pharyngeal arches and their grooves are pouches. These structures which are affected are from first and second pharyngeal arches, grooves and pouches. So we know the first pharyngeal arch is the mandibular arch and the second pharyngeal arch is the hyoid arch. So all these structures derived from the first and second pharyngeal arch are affected. Next we have to know what are the features we can see clinically. So first three will be showing the clinical features of the eye. Okay, what we can see in the eye region we will see. First is anti-mongoloid palpebral fissures. So what is palpebral fissure? So imagine this is the eye So imagine this is the eye. Okay. This distance between the two eyelids, we say it as palpebral fissure. So imagine this is the nose. Okay. So this is the nasal part, this is the temporal part, or you can see this is the medial portion of the palpebral fissure, or this is the lateral portion. So in the normal person, this medial portion or the nasal corner, the nasal corner or the medial portion of palpebral fissure will be lower. This will be lower, like this the eyes will be. Okay, this will be lower in compared to the lateral portion. This is what happens in normal person. Okay, this nasal corner will be lower, or the medial portion of palpebral fissure will be a bit lower compared to the temporal corner. Whereas in this Treacher Collin syndrome, what we can see is this will be a bit higher. Like this, imagine this is the nose. I'm just drawing a very rough diagram. The nasal corner will be higher compared to the temporal corner, or the medial portion of palpebral fissure will be higher in compared to the lateral portion of palpebral fissure. This is what happens in Treacher Collin syndrome, called as anti-mongoloid palpebral fissure. Next, hypertelorism. So hypertelorism is there is an increased distance between two people. The two people distance will be more. Then coloboma of lower lids. What is coloboma? Is a part of normal tissue will be missing. So the lower eyelids, we can see lower eyelashes or even lower lids will be deficient. That is called as coloboma. In some cases, it's not only lower, in some cases upper lids can also be affected. Next, it is hypoplasia of facial bones. So mainly the bones which is affected are malar bone and mandible bone. So main bones are malar bone and mandible bone which are affected. Hypoplasia is there's a defect in formation. Next, so you saw facial bone, there's one defect, and eyes you can see 3 features. Next, you can come to ears. There will be malformations of ears. Mainly it is the external ear which is getting affected, and rarely it can also be the middle ear and inner ear. Next, macrostomia, a large oral cavity, high palate. In some cases, it can be also be cleft palate. Then malocclusion. Of course, due to all these small mandible development is getting affected, ear malformation, high palate, everything, there will be disarrangement and leading to malocclusion of tooth. Next, blind fistulas. So fistulas means what? An abnormal connection between two organs. We call it as blind fistulas. The two sides will be open, then we call it as fistula. So when two sides are open, we call it as fistula. When one side is closed, it is called as blind fistula. So here we can see blind fistula between ear corner and corner of mouth. Between the corner of mouth and angle of ear and mouth. Between this we can see blind fistulas. And we also can see a atypical hair growth, and this will be in a tongue shape. In this shape will be tongue shape, and it will be extending between. So this will be tongue shaped hair growth will be extending towards the cheeks. Okay, it will be a hair growth in the form of tongue shape which will be extending in the cheek region. This is another feature. Next, what we can see is facial clefts, then also skeletal deformities. Now, in coming to salivary glands, we can see either aplasia, absence of salivary glands, or dysplasia. So, when the salivary gland is affected, of course, there will be less salivary secretion. So, we can eventually see dryness and also more caries activity. So, the child will be having increased caries. Now, due to the small mandible, the face feature will be overall like bird-like or fish-like. Okay. Now due to the mandible, and here all the bones are hypoplasia, so mandible can become small, the TMJ get affected. So what happens eventually is your airway is also getting obstruction. So here we can see airway obstruction happening so easily, and when this obstruction is so severe, it can also lead to obstructive sleep apnea syndrome. So this will become a life-threatening condition. This is the most complicated feature in Treacher Collin syndrome. Now, differential diagnosis. What is another one which is very similar to Treacher Collin syndrome is hemifacial microsomia, also called as golden heart syndrome. The other name is also oculo-auriculovertebral dysplasia. Other name is oculo-auriculo. Oculo means eyes. Auriculo is ears. So, oculo-auriculovertebral dysplasia. So, this one, how do you differentiate from Treacher Collin is genetic, whereas this one is sporadic. It is not genetic. Treacher Collin you can see occurring in both sides. That is, it is bilateral. Treacher Collin is always bilateral. This is unilateral. And Treacher Collin is due to the gene affected, whereas this is due to the abnormality in the blood supply in the head region. Okay, so that's how you differentiate from this one, hemifacial microsomia. Next, we have radiographic features. So what you see in radiography is, of course, here main thing which is getting affected is the bones are not getting developed properly. So all the bones you can see being underdeveloped radiographically. Mostly malar bones which are affected. Then mandible is also getting underdeveloped. You can see mandibular hypogenesis. Next, if palate, if you see, if the patient is also having cleft palate can be also appreciated radiographically. There may be, due to the agenesis of the malar bones, if the malar bones are not even formed, you can also see there is no proper fusion of the zygomatic arches. You can see absence of palatine bones. Then if sinuses, paranasal A sinuses can also be underdeveloped. Then here you can see auditory ossicles can be absent. So you can see every bones are getting underdeveloped, which can be seen in radiography. Okay. Now treatment. So you're not just gonna treat one thing. You have to, same like peri-robbing, here also you have to go for a multidisciplinary approach. Here you have to have treatment from an orthodontist, an ophthalmologist for your eyes, then a craniofacial surgeon should be there. Your otolaryngologist is also needed. Your speech pathologist is needed. So everyone together have to treat this. But during birth, if the case is very severe, if the airway obstruction is very high, we have to go for emergency tracheostomy. So emergency tracheostomy at birth can be needed in most severe cases. Okay, that is important to protect the airway. Now when you come to prognosis, actually in Treacher Collin syndrome is having a very good prognosis, and most of the patients, they can live a very normal lifespan. Okay, so this is about Treacher Collin syndrome, and we'll see you with another topic in another video. Thank you.